Welcome everybody to a Zoom call. Looks like everybody here is um, a veteran, so we're going to jump into the questions right away. I've just come to understand that even organic meat can come from animals that have been vaccinated, especially since they cannot use antibiotics. Do you have any thoughts or recommendations on how we can all mitigate the damage coming our way from the recently publicized mRNA vaccines that are being used or are going to be used in our animal products or even regular vaccine products that we are already eating in our organic meat? This is really a tough one because this is heartbreaking. Um, Now, actually, you could read that they're actually using mRNA technology and vaccinating plants. So some of the foods that you're buying, even in Whole Foods market, are vaccinated. If you look at Mercola's site, he's done some articles on this. Some other people have done some articles on this, and they're proud of it. They think that they're doing the world a favor by putting mRNA vaccines in our plants and in our animals. It's very disheartening. How do you get away from this? Um, and the only way that I think that you can get away from this altogether is to be trying your best to grow your own food, buy from local co-ops that you know that and you trust the people that are growing your food. There are meat livestock cattle ranchers that are putting out there that they are not ever vaccinating their animals. I saw an Instagram video of a company that a cattle ranch that said we will never vaccinate our animals. We don't, and going on and on about how everything that they try to do is as organic as possible. And they are very upfront with their statements. I did go to their website, and unfortunately, you pay a whole lot more for the meat. I think it was I can't remember now because it was a few weeks ago that my wife said, "Here, look up this cattle ranch," and because she shared a Instagram post with me, and I looked it up, and it was like $12 a pound for hamburger. Maybe it was even more than that. So it was like, oh, jeepers, this is expensive, when you're trying to feed when you have, 15 of your grandkids coming over and, another 10 adults, it gets to be expensive feeding everybody. So if you're raising a family, it can be extremely expensive to try to do things correct. Um, the we meaning my wife and we are huge gardeners. I've already alluded to that. Someday I'll share pictures of our garden. Maybe next week I'll remember to take some pictures and share some pictures of our garden that we're very proud of. But it's so much work. We just both love to do it. And we do, of course, everything is organic. We don't use anything non-organic on it. And we do it because we eat all our own food and we share it with our children and grandchildren. But we do it mainly, to be honest, because we love to do it. I don't know. When I was a little kid, I wanted to be a farmer. So, you know, we put in sweet corn last year. That was 100% organic sweet corn from Johnny's Seeds. Shared it with our family. Our grandkids literally just ate it right off the stalk without cooking it. It was so good that we put in a whole bunch more this year. But you still, I mean, we did in Canada. We froze a bunch of it, but literally, my wife and I finished everything that we froze within a month. We tried to save 2 bags for Thanksgiving. But to produce enough food for a family, if you're doing it yourself, is very, very difficult. Throughout this whole COVID thing, You hear all this talk about people that, oh, we're just going to go buy 100 acres and live off the land. Okay, most people have no idea how much work that is. So maybe you guys do, but most people have no idea how much work that is. Years ago, my wife and I, and then we had 30 kids at the time. We lived off the land. We lived up on 270 acres in the middle of the woods on a river, completely off grid for 3.5 years. And my sister and brother-in-law, the sister who works for me, Maureen, lived there too then for 2.5 years of that time. And it is, I tell you, we were a lot younger then. So it is very difficult. Now my wife and I do a lot of gardening. My wife mainly does the flowers. I do mainly the vegetables. And it is exhausting to try to live off of everything that you make and grow and eat is, for most people, it's just not doable. So how do you navigate this? Yeah, I don't know. You can't even trust the organic stuff that you buy anymore. Bottom line is you just have to do your best. You just do the best that you possibly can, and you have to trust God for the difference because otherwise you'll go crazy. So, and I don't think that it is reasonable to put that on yourself or on anybody that you have to grow all your own food. um I just think this is the fate of what's going on in the world now, and we're getting close to the end, and I just can't see how human population is going to navigate these mRNA vaccines that are coming our way. So just do your best. Try to do your best. That's all I can say. My naturopathic doctor recently commented that the only scan available that truly identifies a truer tumor as biologically active, meaning living cancer cells, is a PET scan. All other scans, including the Prenuvo, just detect a mass. We assume, obviously, if the size is growing, that's an active cancer. But if we've got a lump that's really staying the same size, there's no way to know if it's fibrotic tissue or cancer or something else. Do I agree? Um, the the answer to that is yes, I do agree. And I'll go even one step further. Just because it's showing up as metabolically active on a PET scan doesn't mean it's necessarily growing. So, I mean, any living tissue is going to have metabolic activity. What a PET scan's looking for is that difference in metabolic activity. Is it highly metabolic? That's going to, as they tune their instrument, um, they're looking for where there's higher metabolic activity in an area. So yes, I would totally agree that a PET scan is the only way to show in a scan what is metabolically active. Everything else is going to look at a mass. They can't look at whether it's living tissue, growing tissue, or anything else. But a PET scan still can't even say that it's growing. So if you really want to know if there's cancer in other places, a PET scan is really the best scan. Now, the reason why a person would choose the Pernuvo over a PET scan is simply because of the radiation issue. With a PET scan, you're getting radiation and you're having to take a sugar dose with a PET scan. And some people are opposed to doing that, and understandable. So you just have to weigh it out what you're really looking for. If you know you have cancer and you know it's active, and you just want to know if you have cancer somewhere else, doing a Prenuvo is the least invasive of those. But if you haven't had a lot of PET scans, you haven't had a lot of CT scans, then getting a PET scan done is more accurate, I would say. So, but it comes with it the invasiveness of the radiation and the invasiveness of having to take the glucose syrup. So that's why people go against it. But again, remember all those things. It's the radiation is measured in what's called a rad dose. The more radiation that you get throughout your lifetime, the more damaging it's going to be. So if you're like, all I've gotten is dental x-rays and maybe some x-rays at my chiropractor, and I got an MRI to diagnose my cancer. I haven't even had a PET scan or a CT scan. Um, but now I have some bone pain, or you have suspect of metastasis, then go ahead and do a PET scan. If you're simply using the PET scan and doing a test just out of curiosity to see if there's metabolic activity and things are growing, then I would question that. Remember, my whole saying about doing a invasive test is you do an invasive test is if it's going to change the way you treat the patient. So, and you as a patient, you would choose to do an invasive test if you're going to choose to change the way you treat it. If you're saying, I'm just curious if the cancer in my breast is metabolically active and growing, I'm not going to do anything different. I'm going to keep doing what I'm doing. Well, then I wouldn't do it. But if it's like, okay, I have this horrible pain in my spine, and I want to make sure that I don't have, metastasis to the spine, and if I did, I might opt to do radiation or something because this is really bothering me. Well, then that's a reason to do a PET scan because it may change the way you treat it. I just started using the Rife last night, and I have 2 more weeks of radiology to undergo because of the 2 targeted lesions that are so dangerously close to pressing on my spinal cord. Is it okay to continue with the radiation while using the Rife? Yes. My opinion is yes. My opinion is yes, it will actually help target the radiation to the cancer because you're hitting the cancer with its own frequencies while you have radiation in your body. So I think it would even work better. So yes. Have you heard of the Signatera test? Personalized blood test that detects your cancer circulating tumor DNA, used to detect relapse, measure treatment for efficacy, and it's covered by insurance for medium to late stage cancer, solid tumor cancers. So if you could do a test like this that is going to measure circulating tumor DNA that is covered by insurance, then by all means go ahead and do it. It is a blood test, and it's not going to be invasive. But if you have to pay out of pocket and you're spending $2,000 for it, it's not giving you quantitative data that is going to be able to measure, it's just that whether it's going to go up or down. So there's positives and negatives to this test, but that was the beauty of the IVGene test. When we had that, it gave you more quantitative numbers so that you could see if your cancer is getting worse or better. This will tell you if your cancer is active, but it doesn't tell you how active. It doesn't, give you that same data, but it can be helpful. It's not a perfect test, but you have to remember no test is a perfect test. So it's just it does it's I the last time I looked at it, maybe they changed their prices. It was a couple $1,000s for the test. So if insurance covers it, then that's great. But if insurance doesn't cover it, then I think it's an expensive test compared to like a tumor marker test. Questions about Rupa Labs. We've had this question from a few people about the Rupa Labs. One person was disappointed because they ordered labs from Rupa Labs and then they couldn't get a draw for a period of time. And then they were told that it could take a couple of weeks to get the test back. Now, understand, any lab is going to tell you it could take a couple of weeks to get the test back. If you're getting, it depends on what you're getting done. If you're getting a Cyrex test, it could take a couple of weeks to get a test back. That's a functional medicine test. If you're getting a CBC and a complete metabolic panel, it usually will come back in a couple of days. Rupa is going to always tell you a couple of weeks, so you are not disappointed in bugging them about when the test is going to come back. When you order through Rupa Labs, you'll have the option to order to find a draw site near you. So if you go find a draw site near you, you could go get your blood drawn right away. You also have the option, And this is through most labs. If you do any online labs, you'll have the option to get a phlebotomist to come to your house for a price. But usually it's about $80 to $150 to have that done. But then you're subject to, comparing your schedule with the phlebotomist schedule, and it could be a couple weeks before the phlebotomist can schedule to come to your house to do that draw. Don't choose that option if you want to get a blood test done quickly. So if you're looking to get something done quickly, don't choose that option. And please understand, we're offering this Rupa lab option to people who can't get their labs done through their local doctor. So this is just an add-on, benefit for people who can't get their labs done. Some people don't have a local doctor to work with. Well, then this is an option. If you have the ability to go through your local doctor or through your oncologist to get labs done, most of the time they're going to be covered by insurance too. So it would be best to do it that way. The Rupa lab option is simply for those people that are like, I don't have a functional doctor anymore. I burned my bridges with my oncologist. He's not going to run anything for me anymore. How do I get labs done? Well, there's positives and negatives in Rupa Labs. Understand, with the Rupa Lab option, we make 0 pennies on Rupa Labs. So it's totally out of our hands. Rupa makes 7%. That's how much they make on the labs. Plus, they have to charge $25 per lab to get a doctor's order. So they have a local physician in the state that you are in that will sign off on the labs. That is a huge issue for any practitioner who's ordering labs for patients that they may talk to online or that are have a practice similar to ours. If you live in Florida and I'm ordering a lab for you, that's a real gray area of legality. I'm not licensed in Florida, and you're going to get a draw in Florida for a lab. You really need a Florida licensed doctor to sign off on that lab. That if you want to stay legal, we could get in trouble, you could get in trouble. So the beauty of Rupa Labs is that's how they function. They have doctors in every state that are licensed that can sign off on your lab. Well, there's a fee for that. It's $25 that's added to each of the lab prices. So when I picked the labs to go into our Rupa Labs store, I picked the labs that we're going to use most often. And they are literally the cost from the lab. And then you pay the $25 and then you pay 7% for the Rupa fee for them to send out the kit and help coordinate. And you can call them and reschedule and do all that. That's what their fee is. We don't make a penny off of it. So I understand if it ends up becoming more expensive than if you went to your doctor and you only had to pay a copay. Well, then choose that option. It's really for people who don't have that option to choose. So, and then if you have to get something done quickly, we have one person that they're 200 miles away from any place to get a draw. Well, then you're kind of stuck. You're going to have to drive. There's nobody that's going to be able to service you unless you are able to drive. So it's difficult, I understand, but we're just trying our best to try to give you a service that will help people that are in that situation. I have been recommended the Black Sam Bloodroot capsule since August of 21 for rectal cancer. I recently had a cheek swab following the surgery, indicating that my supplement should remain the same. I'm wondering if that still applies to my Black Sam Bloodroot, since my large intestine is being temporarily bypassed via the ileostomy, and the Bloodroot may not make it to the large intestine. The answer is yes, that still applies. So you're absorbing, we're not killing directly with the Black Sam capsule. You're absorbing most of it before it got to that area. It's what's in the Black Sam Bloodroot capsules is bloodroot, which is an herb, graviola, burdock, and chaparral. There are 4 different herbs that are really good for cancer, not just colorectal cancer, but really good for different cancers. So yes, you're absorbing that, it's going through the bloodstream, it's helping. Our goal is that it helps kill cancer cells anywhere it finds them, including metastatic cells. So yes, stay on that protocol. I am taking sulforazyme at 4 a day, EstroClear at 3 a day, and AromaClear at 3 a day. I am having hot flashes. Should I take them at a certain time of the day? Do the hot flashes mean anything bad? No, the hot flashes actually mean that it's working. So you're using sulforazyme, which is um, broccoli seed extract product, and EstroClear, which is lignin to help pull out estrogens, and AromaClear, which is IC3 and DIM and something else to help pull out estrogens. If you effectively pull out estrogens, you will have hot flashes. This is why people on letrozole, which is an aromatase inhibitor, don't like it, because they're having hot flashes. How can I prevent these hot flashes? Well, the hot flashes are really a sign that they're really working. So it's not that you can't prevent that. Really, that's what you're going to get when you do what you were trying to do. A few weeks back, I mentioned breaking out in a rash, hives in several places. It's still there, around my shoulders, lower back, spine, left, right thigh, and under right knee, and sometimes along both calves, itchy at different times. Is this a detox reaction, or can this be related to liver, having too much to filter, etc.? At what point is it a concern? When I first mentioned this, I recently changed laundry detergent as the old one was discontinued. Now I switched to an organic rated detergent. So can a person have hives and rash because they're overwhelming their liver and you're trying to detox through the skin? Yes. Another thing that can stimulate hives and rash is a huge emotional change, stress on your adrenals. I remember when I was in school, after my finals of my first semester, it was so stressful. I literally broke out in a rash all over my body for 2 weeks. It was the 2 week break from you know where, because I didn't get any rest for 2 weeks. I was just under so much stress. That can do it. So can I have an allergy reaction all of a sudden from something? That could do it. Usually if it's from a detergent, like I initially said, usually that would go away after a period of time. Here's what I would suggest to try to figure this out. Number one, I would do a CBC. That's a complete blood count. What you're really looking for is an increase in eosinophils, to see if it's an allergic reaction of something like an allergen to something. If there's a spike in eosinophils, then that's what we really know what's going on. It can be an allergy to some environmental. That's typically what you'll get a eosinophil reaction. If your CBC is all completely normal, there's nothing abnormal there, then we just got to keep digging. Is there a food sensitivity? Then you have to look at that possibility. And you're like, well, I've never had food sensitivities before, and I'm not eating anything different in my diet. Well, you can develop antibodies to different foods for a zillion different reasons. And if the only way to really know that is to do a Cyrex array 10 test to see if something is going on with that. The most common foods would be your basic most common foods would be gluten, dairy, eggs, corn. So you could do a food elimination to see if it's something like that that's going on. If it's like, well, my liver is overwhelmed, you'd have to go, well, again, why would your liver be overwhelmed unless unless you're exposed to a whole lot of toxins. I've had people throughout my years have a reaction like this because they were farmers and they just put GMO corn on their field, or they just sprayed their field with pesticides, and they were very, very careful, but they're exposed to a lot of chemicals. And I've had people that were painters and they did a big painting job, or they did a spray job, and they're exposed to a different chemical in a paint like this. I had one person that their child had broken out like this, and we couldn't figure out what it was. And I actually went over to their house and tested it. And in the children's bedroom, they had just moved into a brand new log cabin, and they had painted with linseed oil on the inside of the cabin. It was all, they stained it with linseed oil. Well, then he tested him and he came up arsenic toxicity. And then the mother did some research on linseed oil and found that all linseed oil, except if you get a natural organic linseed oil, which was like 4 times as expensive, linseed oil needs to be rendered. So it's rendered, they add arsenic to the rendering because it speeds up the rendering process, and they can sell it a lot cheaper. So the 1-bedroom wall where the 4 kids or the 3 kids were in bunk beds in that bedroom was still sticky. It just didn't dry correctly, and the kids were exposed to the arsenic and the linseed oil. So I would kind of search for, and maybe you have already done that, I would search for environmental factors that maybe something you were exposed to, or that if you could put your finger on. Just to say, oh, it's a detox reaction, I'm not a big fan of, just blaming a detox reaction. Now, if, let's say, you were eating horribly your whole life, and then you just made a major change in your diet and you're starting to clean up your diet, you could have a reaction that could last a few days to a week, or maybe even 2 weeks. But this isn't the case with the person who wrote this. So I think we need to dig a little bit deeper and see what's going on, because I would have thought that this would have cleared up by now. So if you need some help, we can chat about that. Some alternative cancer practitioners say that cancer is very smart and you should alter your approach, perhaps changing the way you take care of nutraceuticals. I think also TrueRife also changes up application of frequencies for similar reasons. Thoughts on doing this? Well, certainly if a person's cancer is continuing to grow, we always want to look at adding different frequencies. Now, I don't tend to think we need to change the TrueRife frequencies that often in the case of how I program the Rifes for people. Not that I'm special, but most people use their TrueRife like an hour a day at maximum. So we're using it all night long. So I put so many different frequencies in your night. Now, I am not opposed at all to saying, hey, I'm willing to, I'm totally willing to, if you want me to tweak up your programming, I would gladly do that for you. Now, I will almost always do that if a person is getting worse or something's metastasized and I tested and it comes out that, then we'll be tweaking their program. So you just, send in a cheek swab with that request. That's why I put that request on the cheek swab form. You want me to specifically check for frequency changes. And this is why we've said over and over about the nutraceuticals too. Sometimes it can be good to do what's called not a complete change up of your nutraceuticals, but pulsing your nutraceuticals. So you might go off for a week, just kind of clean out, let your body clean out, go off of it for a week. That can be the case with a rash too. You could develop a sensitivity to actually one of your supplements. That's a possibility. So think about, pulsing them. Instead of pulsing them all off for a week, pulse off one at a time for a week, see if there's any change in the rash. Maybe that's a possibility of what's going on too. Would a castor oil pack help some inflammation on the lymph node? Any suggestions? Do dry brushing and some rolling, but some days that area is very sore. You can, I mean, you can try it. I mean, there's no like, oh, this is what castor oil is going to do all the time. There's you just can't make those blanket statements. We have some people that are doing castor oil packs over a breast tumor. We have some people that tried it and said, no, it just made it more inflamed, it made it worse. Everybody's different. So give it a try, do it once. I would just do it, start off doing it for a short period of time, see how it works, and see any changes and note any changes and test it. I have breast cancer. Are lymphatic massages okay? So this lymphatic massages, I think, are okay if you go to someone who's trained in cancer massage therapy. I don't think just general lymphatic massages where they're going really deep and they could aggravate a cancer. I don't think that's helpful. If they're gentle and they're staying away from the site of the cancer, then I think you're fine. But you don't want to physically aggravate a cancer either. So I'd be careful with that. I had a baby in September and was told not to do coffee enemas. I am not pregnant now, so how often should I be doing coffee enemas? So we have some people that are doing coffee enemas daily. We have some people that are really sick that are doing multiple coffee enemas a day. We have some people that are doing coffee enemas once a week, a couple times a week. There's some people that are not doing coffee enemas at all. I fit into that category right now. I haven't done a coffee enema for a couple months now. So it really depends on how you're doing. If you're doing well and your cancer is in a relative state of remission, do you need to do coffee enemas? Well, you got to go look back at why you would do coffee enemas. So number one, the number one reason why you do coffee enemas in my book is to stimulate your parasympathetics. So if you are a fairly parasympathetic driven person, meaning that you're really chill pill, you're really calm because your parasympathetics are going to calm your brain, are going to calm your mind. Let's say if you asked your best friend, probably not your husband, but if you asked your best friend, do you think I have a lot of anxiety? And they were honest to you and said, yeah, you're kind of a high-strung person, you're kind of a lot of anxiety, then coffee enemas are best for you. If you're like, no, you are just so absolute chill, you're the chillest person I know, and they're being honest, then there's maybe a little bit less need for coffee enemas. But it's not solely, so the parasympathetics do other things. So it stimulates your immune system, it stimulates your detoxification pathway. So if you have issues with your detoxification pathways, then coffee enemas will help stimulate your detox pathways in your liver. If you're having an increased growth of cancer and you need a higher stimulation of your immune system, coffee enemas are the thing to do. So not everybody needs to do coffee enemas. Don't listen to the stuff out there that if you aren't doing coffee enemas, you're not going to get better from your cancer. That's just not true. I have people, maybe even on this call, that have never done a coffee enema in their life, and they're doing really well with their cancer. So everybody is different. Last part of this question, I was told to do coffee enemas can be drying to the body. I would disagree with that. So it was suggested to do seaweed enemas too. Thoughts on this? I would disagree with that. Seaweed enemas, seaweed is going to be a lot of iodine. So remember what we've talked about with all the latest research on iodine and Hashimoto's. So if you have any issues with your thyroid and you're taking iodine for any length of time, it's a high possibility that any hypothyroidism is going to turn into Hashimoto's. It will stimulate an autoimmune attack on your thyroid. So not a big fan of seaweed enemas for that reason. I also saw the disturbing articles on Mercola's site about the mRNA in our food supply. Is there anything we can do to detox it so it doesn't accumulate and hurt us as bad? Well, there's no perfect way to detox the mRNA because there's just not enough known about it. Now, I've always said that the lumbro kinase and natto kinase is, oh, why did I change that? Um, uh, is some of the best things to help detox the mRNA, plus your binders. So nattokinase and lumbrokinase are enzymes. We actually have a brand new product out. We actually have two brand new private label products. One is called Circulation Clear Circulation. And the other one is ClearTox. So ClearTox was actually created specifically to detox the mRNA vaccine. It has lumbrokinase in it, has nattokinase, so does the Circulation Clear, has lumbrokinase and nattokinase. But if you have issues from the vaccine or from being exposed to people with the vaccine and are having heart issues, I would take the Circulation Clear. If you're like, no, I'm not having any of those issues, I just don't want to have issues, I'm trying to detox this mRNA vaccine, then take the ClearTox. ClearTox just has some other binders and things in it that Circulation Clear has more things in it to support your heart. The ClearTox has more things in it, has both the lumbrokinase and nattokinase, both of them do, but it also has stuff in there to help detox the toxin. So after taking a 14-day prednisone treatment and finished, and then waiting 3 weeks after, can the prednisone affect the results of a PET scan? Huh. I don't know. You'll have to ask the radiologist that. I don't know. I don't think so. I don't know the answer to that. Yeah, for sure. What is the Rupa lab test that we've been talking about? The Rupa lab test is not a lab test. It's a Rupa is a company that we partnered with in order to be able to give to offer labs to you and our members. So it's all over our member site. We can now order labs. It's through our partner, Rupa Labs. I am experiencing pain in my spine at the location where I had surgery. Could this be part of the healing process or a sign of the disease? The answer is yes, could be either. And the only way to totally know if it's metastasized to that area is a PET scan or a CT scan would see that too. It's but it can be healing too. So as you're healing from an injury, you're going to have pain. So I know we said this before. Whenever we have cancer and any pain or any symptom, we go, oh, it's getting worse. But that may be true, but it's not always true. So we just got to be careful not to go there mentally. The only way to know for sure is to do a scan to see what's going on. So if the pain is excruciating and it's that's one other way to know if the pain is unbearable, it's very high on a scale of 1 to 10, then that's not normal. It's not normal healing pain. Then I would definitely talk to the doctor about that. I'm reading a book called The Metabolic Approach to Cancer by Dr. Nasha Winters. On page 125, it talks about human breast milk. It calls it the most incredible superfood on the planet and says some adults are using it to fight against their cancer. Apparently, researchers in Sweden discovered that a substance found in the human breast milk has selective ability to kill cancer cells. I have a niece who pumps breast milk and is willing to supply me with frozen best breast milk. Do you think it'd be a good idea for me to drink this? I'm in my late 50s and was not breastfed as a baby. Well, I do, think that human breast milk is amazing, and all my children were breastfed, until they were weaned a lot later than most people are weaning these days. All my grandchildren were breastfed and are still breastfed, some of them. And so it is amazing. It has different antibodies to fight different diseases and all sorts of different things. Do I think there's a downside? No, not really. I don't think so. My naturopathic doctor says ultrasound is radiation, just non-ionizing. Well, from a physics standpoint, everything is radiation. The sunshine is radiation. So yeah, technically the answer is correct. But when you're talking about radiation that is dangerous to your body, then yeah, I guess your ND is correct. It is radiation. It's just non-ionizing radiation. It's not going to damage cells. Problem is studies show non-ionizing radiation is not as safe as we were once told. The dark side of prenatal ultrasounds, blah blah blah. Yeah, I would agree. There can be, a downside to doing too many prenatal ultrasounds, or but again, it's a much less invasive way to look at and to measure something. So we used to use ultrasound as a therapy tool. So ultrasound can be therapeutic as those ultrasonic waves go through there to help clean out the tissue and help to detox tissue as well in a healing mode. Can there be downsides to anything? There can be. Again, you do any test because you're looking for data, because it may change the way you treat. So that's how you measure that. There could be downsides to too much ultrasound in a pure world, yes, but there could be upsides because it could really help determine how you're moving forward and what you need to do. I did 2 baking soda wraps that I watched on Barbara O'Neill's YouTube, and now I am feeling depleted. I don't feel good now. Is this normal? I don't know. I have not ever done a baking soda wrap, and I'm really not even familiar with the baking soda wrap that this person advocates. So baking soda is sodium bicarbonate, and it's a strong base. Now, the whole idea of acid base balance, if any of you have been with me long enough, have heard my take on that, and that cancer can't grow in an alkaline environment, and you need to alkalize your body, and cancer only grows in an acidic environment. To me, that is just a bunch of hooey. So I think any highly metabolic cell is going to produce a lot of waste, and that waste is going to be acidic. It's not growing because it's an acidic environment. It's creating an acidic environment. Now, I know Dr. Simoncini would inject baking soda at the site of the cancer and had some success. How much success he had, we don't know. He ended up getting thrown in jail in Italy for what he did. We have no idea. Maybe he got thrown in jail because he was helping people. Maybe he got thrown in jail because he hurt people. We just don't know. I do think that if you injected baking soda at the site of a cancer, to me, it makes sense that it would actually help from a physiological standpoint, because at the site of the cancer is very acidic. However, to get baking soda or to get an alkaline solution at the site of a cancer, you'd have to inject it. If you're going to ingest it, taking it orally, and you don't have cancer in the stomach or the first part of the small intestine, it's just going to break down, and you're just making your stomach alkaline. That's like taking alkaline water. To me, it makes no physiological sense whatsoever, because you're just alkalizing your stomach acid, which you're just completely counterintuitive to how your body has to use hydrochloric acid to digest. Plus, you have what's called a buffering system in your body that will buffer anything. But if you expose yourself to too much acid, you can make yourself ill for a period of time. You expose yourself to too much base or alkaline product, you can make yourself ill. So don't just think because it's alkaline, it's good. High degree of alkalinity is just as caustic as a low pH of a low acidic solution is caustic. You want to burn somebody, you spill some sulfuric acid on them. You want to burn somebody, put some high, a concentration of a high pH product on them. You can still burn somebody. It's just as caustic and just as dangerous. So the idea you're going to measure pH on a person is really ridiculous. You can't measure urinary or salivary pH and say this person is alkaline or acidic. All it says is their urine is alkaline acidic, and if you give a person some minerals, they'll probably alkalize their urine because they'll spill extra minerals in their urine, which is how your body buffers the acid-base system. So I don't know, I just drink a lot of water personally, try to flush anything out of your body and just get your body back in balance that way. That's what I would do with anything. Remember, that's one of the best ways to help your body in any hyperexposure of anything, whether it's a hyperexposure of pollen or a hyperexposure of, bad food. Drink a lot of water. The old saying that dilution is the solution to pollution is a cute little saying, and it's so true. Your body, if you dilute it, you're going to help decrease the pollution and help flush out that thing in your body, whatever that is. If my AFP is still elevated, this is a tumor marker, after we remove the tumors, what is elevating it? So your tumor markers, remember, so first of all the tumor marker tests are just physiological tests. They're not only produced by tumors. Otherwise, if you don't have any cancer, they'd all be zero. They're never zero. There's a normal range. So it's never going to go down to zero. And you don't want it to. Other things in your body make that chemical. It's just found that growing tumors tend to make that specific chemical in greater concentration. Therefore, you could use it as a marker of cancerous growth. If you have solely a breast tumor, let's say, and you remove your breast and there's no metastasis anywhere else by any visual means that we can tell with a PET scan, and you still show elevated tumor markers after you have the breast removed, why are you still showing elevated tumor markers? Well, the answer is, I don't know for sure. Could it be that you have hidden metastasis? That is a possibility. Remember, even on a PET scan, remember we said no test is perfect, and even with a PET scan, you have to have a cancerous mass of over 3 million cells large to even show up positive on a PET scan. So there is a possibility that there is still some metastasis in the body. There's a possibility that maybe other cells are producing that tumor marker at a greater concentration that aren't cancerous. So we just don't know. Maybe it's going to take some time for that to go down. Somebody asked me a question similar to this a while back, several months ago, that because their tumor marker, how long does it take for tumor markers to go down? And I said, well, I have just seen in practice that sometimes it takes a while, even after you're on a chemo or after you're doing the right thing, the tumor marker still stays elevated. And the question was to think the following week, well, why would that be? And this is very confusing. Well, it is very confusing. This is why none of these tests are perfect. So this is why a lot of oncologists have stopped using tumor markers, because if you're going to do what they tell you to do, which is do the chemotherapy, lots of times that makes the tumor marker go up. So if you kill the tumors effectively with what's called something that will cause cell lysis, then it can actually spill more of the tumor marker out, and you can elevate it, and the patient goes freakazoid because they hey, I agreed to do this chemo and I'm getting worse according to the tumor marker test. So a lot of oncologists just don't do those. That's why you have to ask for them. So there isn't the perfect science to any of this. And we get frustrated with science, but the truth is nothing is perfect, and we don't have a perfect way to see inside your body to know exactly what's going on. So hopefully it's going to go down. That's what we want it to go down. We want to, again, this is why we don't ever just look at one test. So you want to look at other things in comparison to see what else is going on, if that we can look at any other objective things and subjective things. Instead of wrapping in wet towels and blankets, I dipped my clothes and laid in my infrared sauna. So you're talking about the baking soda wrap. So instead of wrapping in wet towels and blankets, I dipped my clothes and laid in my infrared sauna. Okay. So, all right. So I've never wrapped in wet towels and blankets in my infrared sauna. Still not fully understanding what it is. I guess I'll have to watch that video. I am putting castor oil on my breast tumor. It has been the only thing that has stopped the bleeding. So this goes back to that other question about castor oil on their tumor. But now there's a lot of white blotches and lines that look like fungus. What do you suggest that I do to deal with the white fungus coming out of the tumor, if anything? So if there's stuff coming out of the tumor, to me, that's almost always a good thing. If it's a fungus, you can certainly put some hydrogen peroxide in a bottle and squirt a little bit of that on the open wound. You could use some colloidal silver in a bottle and squirt a little bit of that. Treat that a couple times a day and alternate maybe those two. I would do those two things. I don't think the castor oil would feed a fungus, but it may be drawing it out. So those two suggestions might help kill it if it is. Does Rupa replace the Exivia or the Welevate test? Yes, it does. And the reason it does is for what I said, when we were doing the Welevate test, that was getting us in potential hot water because you really need a licensed doctor in your state legally to okay and approve and quote unquote order a test for you. So we were in really gray area there, and the issues that any board could come after us and say that we're practicing medicine in your state by ordering a test for somebody in Illinois. They'd have a case against us. So using Rupa, we're not ordering the test. They're getting an Illinois licensed doctor that's basically signing off on the order, therefore keeping it completely legal for everybody. In surgery, they said they got all the cancer. Fantastic. My PET scan the week before surgery showed cancer nowhere else in my body. Would the hospital consider me in remission? I would say, yeah, they probably would. Every clinic group may have a different definition of remission. Typically, it's what's called NED, no evidence of disease, meaning that in all their testing, they can't find any disease. You don't show anything positive on a PET scan, and that would be no evidence of disease. My FT is elevated. I'm doing your supplements. Ralph Boss's Big 5 nutraceuticals for the stem cells. No chemo, no radiation, no tamoxifen. Any approvals or warnings regarding this? Also, do you think it's worth taking the Hoxy tonic? Is that worth it? I know you're probably taking a lot of stuff already. I don't know if I would add anything. So remember, too much of a good thing can be a bad thing. We talk about taking too many supplements can affect your liver and can put stress on your liver because your liver has to detoxify those two. So be careful of that. What are your thoughts about taking Celtic's salt? Um, you got to be careful with any salt. So remember, just because you have cancer doesn't mean you don't have other issues like autoimmune issues. So in my book, I write, I think that a lot of people with cancer, there's an autoimmune component to it. And if you go through the chronic disease and autoimmune course, you'll learn that one thing that can cause a flare of autoimmune disease is too much salt. Any salt, pig salt, Celtic salt, any salt whatsoever can cause a flare of autoimmune disease in a certain group of people. It can also cause high blood pressure in a certain group of people, issues too. And those are really real. I don't care, what video you show me or watch that says that this certain pink salt or this Himalayan salt or this salt is so good for you because it's got minerals in it and everything. Well, the truth is, it's still a salt. And the minerals in there are really stone minerals or earth minerals, which are not the kind of minerals you're supposed to be eating anyhow. You're supposed to be eating vegetables that take earth minerals, which are inorganic hard solids and salts, and turns it into a mineral that's double bonded to an amino acid. And then we consume that that product, which is a vegetable. That's why the only minerals that we sell, that we private label in our store, are minerals that are double bonded to an amino acid, the same way that you would get them by eating vegetables. So I would say I pass on that. Is iodine as a supplement not a good idea to take? Well, iodine can be helpful for people with breast cancer, but I still say only on a very short-term basis. In general, so if a person is taking iodine, especially as a female, you have an increased risk of creating a Hashimoto's disorder. So iodine is necessary for my thyroid to produce T3, you say. Well, that's very true, but it's very, very small amount of iodine. And if you take any iodine in a mineral supplement or iodine straight of any milligram solution, you risk increasing a stimulation on your thyroid gland and increasing a stimulation of your immune system and creating a Hashimoto's, and end up with a TPO antibody production or a thyroglobulin antibody production. So long-term, yes, I'd say you should hold off on that. Just did my mouth cheek swab with you, and you stated to back off to only one Berber clear. What is the reason for that? It's just because that's what tested. So when I test things, I test for dosage. So that's just what tested. So have you seen the Rife heal cancer? Have you seen Rife heal cancer in the bone? Yes, for sure. Yes. So remember, that's the beauty of the Rife. I mean, so let me step back. It's if you were doing chemotherapy, let's say a person has cancer that's metastasized to their bone. Statistically, chemotherapy is not going to work that well because you do have blood supply to the bone, but it's limited. It's hard to get healing nutrients to the bone, just like it's hard to get healing nutrients to the brain because you have a blood-brain barrier. Well, you do have a blood supply to the bone, but it is limited, and it's difficult to get that there. So even chemotherapy to the bone, it's going to be difficult. That's why they would typically suggest radiation to the bone to kill the cancer, which I think can be a really good idea. I've seen it over and over again. Using radiation to the cancer can be amazing because you could do just a few sessions and it can kill all the cancer in that bone. So if a person has metastasis to the bone and it's causing issues, should be just for everybody, but you could knock it down just very quick with radiation. So don't be dogmatically positioned against radiation. However, it's hard to get nutrients in your immune system and T cells to go and kill something in the bone. Um, that's where the rife is so beautiful, because the frequencies are going right through you. So the rife is going to go right into your brain. The rife is going to go right into your bone. So that's a huge, huge benefit. I bought the whole Zodia series and watched your video, episode 8 last night. Very good. Okay, so that must have been something I was interviewed in. Okay, well, that's great. Fantastic. I don't remember what that is, though. And I've never listened to one of my videos or interviews in my entire life. Sorry, but I can't stand listening myself. The husband feels that the rife is causing his ears to ring. Does this make sense to you? Well, it's possible. I mean, just the tone, the noise of the rife could irritate a tinnitus. So that is possible for sure. I'd try to muffle it. Maybe put a pillow over the machine so you muffle the noise a little bit. Possibly have him wear earplugs to bed, see if that makes a difference. To see if it is the noise of the rife that's doing that. It can't. So when a person has tinnitus, any audible frequency can be a stimulant that can be irritating. So that is possible. There was a margin of less than 1 millimeter of when the surgeon removed my tumor from the pectoralis muscle. Why do you think she didn't take a deeper margin? She passed away a month after my surgery, suddenly, unexpectedly. So I can't ask her. Is that a thin margin? That's dangerous. Well, understand, she may have thought she took a much bigger margin, but then when that sample is sent to the lab, they measure that margin, and that was measured at 1 millimeter. There's no way she can see the margin to be 1 millimeter. She'd have to, this it's not physically able to see that. Also, she might have not wanted to damage your pectoralis muscle anymore, because you cut the fibers of the muscle. I mean, you cut the fibers, so you'd have to. You can't stitch up the individual fibers. You're going to damage the muscle itself. So maybe that's it. Speaking to her passing away suddenly, that's very sad. I just talked to a doctor friend of mine who just got a job at Mayo in December. And he was forced to get the vaccine in December. He was at another hospital, and they accepted his religious exemption to not get the vaccine, but that hospital system was bought out, and he was going to lose his job like a whole bunch of other people, and he was offered a job at Mayo, but they made him get the vaccine. He told me yesterday, he goes, I have not been the same. It's just changed my life 100%. That's what he said. So try to help him clear that out of his body. So I would say that that was the margin of less than 1 millimeter was found on the pathology sample. But to be honest, if it's found on the pathology sample and it's a margin of 1 millimeter, it's a margin. That's all you need is a margin. So, you don't need I think a margin of 1 millimeter, or should we take a margin of a centimeter? That would have been better. Really? I don't know. I don't think so. I mean, you just take your whole pec muscle and you're not going to get any cancer there. That's not the case. Your goal right now is to keep all your circulating tumor cells at bay. Everything you're doing with a rife on a daily basis, And everything you're doing with everything else on a daily basis, your nutrition is to help kill circulating tumor cells. I'll tell you, I'll put it out there right now. I can't tell you how many people that we find out that they, have passed away. This is doing this for 25 years now. And we get their Rife back, and they stopped using their Rife 7 months ago or a year ago because they thought they were cured. And their cancer, quote unquote, came back with a vengeance. And then they were so sick they didn't even start using it again, and they passed away. Well, remember, circulating tumor cells will not show up on a PET scan. Everybody's got them. Everybody's got cancer cells, even if you've never been diagnosed with cancer. Keep using your Rife. Don't stop. Don't get lazy. Don't think you don't use it anymore. Continue to use it on a daily basis. All right, with that, we'll say goodbye and know that I'm praying for you guys all, and foot baths too. Not necessarily, but continue to use your Rife. And till next week, if you need personal attention, make sure you call and schedule time with me too. All right, love you all. Bye-bye.